Maydy, and I'm really pleased to introduce her to you. Maydy Lowe is a behavioral health public policy consultant for the California Behavioral Health Planning Council, and I'll let you get started.
Okay. Well, thank you all for having me today. It's really great to be here and provide the Planning Council's meeting updates with you all. So bear with me. It's been a long week, but very productive for all of our committees and the council as a whole. So we'll start off with our Patient Rights Committee. They discussed how to further engage with the local behavioral health boards and commissions to increase awareness and engagement on patient rights issues. The committee also heard from Daniel Wagner, who's the director of the California Office of Patient Rights, who did share about their recent activities, including their patient rights annual training conference and updates to the patient rights advocacy manual, as well as the patient rights advocate training on online training. The committee also discussed Senate Bill 1401, which is authored by Senator Stern, and did vote to recommend an opposed position to the council's Legislation and Public Policy Committee. And then lastly, the committee received a presentation from Marcus Cannon, who is the Deputy Director of Forensics for the Riverside Behavioral Health Department, who shared with the committee about the CARE implementation in Riverside County. He discussed how the county behavioral health has informed and educated the public about CARE Court, the numbers of petitions the county has received, and the CARE Court agreements to date, as well as challenges and successes that they have had or seen in the CARE Act. Moving forward, we into the Legislation and Public Policy Committee. And the committee did look at several bills, a total of 9 actually. The committee did approve the consent agenda, which outlined support positions for 3 bills. Assembly Bill 1586, authored by Assemblymember Ramos, which would require school resource officers to complete opioid overdose recognition and response training. And then Assembly Bill 1932, authored by Assemblymember El-Hawari. I can never pronounce her name. The bill would extend the Community Response Initiative to strengthen emergency systems, which is the crisis grant program, to June 30th, 2032. And then also Assembly Bill 2150, authored by Assemblymember Haney, which would require employers who require CPR training of its employees to also require those employees to take an online video module training on the use of naloxone as well. So those were all support positions. The committee also reviewed the current list of legislation that the council has already taken positions on, and did discuss 2 bills that were gutted and amended. These were Assembly Bill 1267, authored by Assemblymember Pellerin, and then Senate Bill 28 by Senator Umberg. AB 1267 is no longer relevant to behavioral health, so the council will be removing that off of our list of positions. As far as Senate Bill 28, it originally proposed provisions related to Prop 36. However, the most recent amendments, the most recent bill did introduce significant amendments related to the CARE Act and the LPS Act. Some of the key provisions include, it's a lot, but just couple of the key provisions. It would authorize a conservator to request the court refer conservatees to CARE Court upon termination of a conservatorship, and then also authorizes an individual to qualify for the CARE Act if, among the other existing requirements, the individual has not been clinically stabilized and ongoing voluntary treatment for more than 90 days prior to the CARE Court filing. So just a couple of the tidbits with that. So that was wasn't a post position that the committee took. Additionally, the committee received updates regarding advocacy activities related to bills that the council has already taken positions on since the last meeting in April. which included support letters being sent out for Assembly Bill 96 by author Assemblymember Jackson, Senate Bill 936 by Senator Blake Spear, and Assembly Bill 2003 by Assemblymember Berman. We did also send an opposition letter to Senate Bill 1016 as well. We also sent a recommendations letter to Assemblymember Bonta's office regarding the committee's recommended amendments to Assembly Bill 2161, which is related to the Medi-Cal work and redeterminations and work community engagement provisions. Additionally, council staff did attend hearings for Senate Bill 1221 by Senator Stern and Senate Bill 989 by Senator Blake Spear to state that council's opposition to those bills. All of our letters are posted on the Legislation and Public Policies Committee's webpage on the council's website. So if you anybody wants to take a look at those letters, you're more than free. It's all posted there now. Additionally, the committee discussed other bills. They did take a support if amended position to Assembly Bill 1556, which is authored by Assemblymember Haney. The bill pretty much relates to recovery residences to specify requirements that would make recovery residences eligible for state funding. And so just a couple of the recommended amendments that the committee discussed was including the bill to include a statement that would clarify that other SUD recovery residences are not impacted by these provisions that are being set forth in the bill. And then also they made a recommendation to remove the requirement for providers to secure and offer alternative housing options to residents, rather instead require providers to offer. Just because of the difficulties and the challenges of the housing in general, it may be unrealistic for providers. The committee did state that it may be unrealistic to require providers to find and secure them housing before they are either they volunteer to remove themselves from the housing, or if they are at risk of being evicted due to these violations. The committee also took watch positions on two bills: Assembly Bill 1899, authored by Assemblymember Caloza, which intends to establish the Office of Youth Prevention within the California Interagency Council on Homelessness, and then also Senate Bill 926 by Senator Strickland that would create the Prop 36 fund to fund the Prop 36 activities. The committee also took an opposed position on two bills. One, of course, was at the recommendation of Patient Rights Committee on Senate Bill 1401 by Senator Stern, and this one's relating to mental health criminal procedures for those individuals who are incompetent to stand trial and ineligible for mental health diversion. And then lastly, the other bill they opposed was Assembly Bill 1825 by Assemblymember Krell, which would make changes to the Offenders with Mental Health Disorders program and require the Department of Corrections and Rehabilitation to create exit plans that would require Medi-Cal applications for Medi-Cal benefits and referrals to county resources and programs. Moving forward to our Housing Homelessness Committee, the committee did discuss and review the CalICH's the state guidance on implementing recovery housing in California, and they will be submitting a letter to outline what those feedback and recommendations are. The committee also heard from the California Department of Social Services on their community care expansion program that was established to support the development and preservation of supportive residential care for adults and older adults who are at risk of homelessness. CDSS did report that 39 counties have opted in with a total of 8,385 statewide beds and units created, which did exceed their goal of 7,000 beds statewide. And then lastly, the committee heard from Palm Desert Recovery Center on their long-term offender reentry recovery program, which is a contract under the Department of Corrections and Rehabilitation. It is geared to assist individuals who are returning from incarceration after a long period of time. with life skills and successful reintegration. So they use career-driven support, guidance, and assistance. With our Performance Outcomes Committee, the committee did receive an update regarding the public forum event that the committee helped organize on yesterday. The forum was developed to collect stakeholder feedback on the BHSA 3-year integrated plan community planning process. It was hosted here at the Riverside Convention Center. We had 100 people registered to attend, and they do plan to hold a virtual session as well in early July because there was a lot of interest in gathering more and hearing more from stakeholders. The committee also received updates from Samantha Spengler regarding the BHSA Quality and Equity Advisory Committee. She did inform the committee about the standardized performance outcomes measures being developed by the Department of Healthcare Services, and then also advised the committee on how the data can be used in the future. The committee also reviewed, that screen. The committee also reviewed the 2026 Data Notebook Survey, a document on the behavioral health services for foster youth. The final feedback and edits were collected for the document, and they will be distributing their survey to counties as soon as possible following this meeting, our quarterly end of quarterly meeting. So hopefully soon. The committee did have a panel on foster youth services and high fidelity wraparound implementation as well. And then they did also identify and discuss potential topics for the 2027 Data Notebook Survey. They named several access to services for older adults, pregnant and parenting youth in the behavioral health system, patients' rights and voluntary versus involuntary services, and then changes and cuts to prevention services as a result of the BHSA implementation. So they haven't defined yet which topic they're going to go with, but they're going to be working towards that. The Workforce and Employment Committee, the committee did receive an update on the action items that the committee voted to take in regards to providing input on the draft 2026 to 2030 Workforce and Education and Training 5-year plan. Which did include 2 recommendations letter for the draft WET plan. So the first letter that the committee sent out was developed from the committee as well as the WET Steering Committee as well as the public attendees. And then that letter was based on HCI's presentation during our meeting in April. So that first letter was sent out. And then in response to the draft plan that HCI released on May for public comment, the committee submitted a second recommendations letter based on feedback that was gathered during the committee and the WET Steering Committee's in-between meeting that they held. And both letters are also posted on the council's website. If you look under the Workforce and Employment Committee webpage, you'll be able to find those letters there as well. And then the council did approve the draft 2026-2030 WET plan at the general session meeting this morning, with an addendum to review the previous plan and include occupational therapists and physician's assistants throughout the document as well. And then lastly, the committee heard from the Riverside University Health System and Telecare regarding the employment of peer support specialists, who did emphasize the value of peer workforce as an integral part of the behavioral health workforce. Lastly, yes, we are down to our last committee, the Systems and Medicaid Committee. They focused during this meeting. Their meeting was focused on the Justice Involved Reentry Initiative. So they did receive an overview of what the initiative is from the Department of Healthcare Services. They heard from the County Behavioral Health Directors Association, who provided a perspective on the implementation of the initiative and jail in-reach services across the counties from like a policy perspective. And then they also heard presentations from Orange County and Sarasota County on the implementation of the program and the in-reach service, the jail in-reach services themselves. And then lastly, the committee also discussed potential topics to present to the full council at the general session meeting in October. They expressed interest in inviting a county to present on the BHSA 3-year integrated plans, as well as hearing about the actions that the counties are taking to revise plans based on stakeholder feedback. But that is all.